Welcome back to the Because Show. Joining us today is Dr. Tiffany Diaz with Alexian Brothers, and you're located actually right here in Schaumburg.
Yep, right down the street from here.
Is it a relatively new facility?
No, the practice has been around over 30 years, but I just joined the practice about 6 months ago.
Well, welcome to Schaumburg.
Thanks.
And today, for anybody who's ever had the chills, the fever, the cough of the flu, we're talking all about that with Dr. Diaz today. And Dr. Diaz, what exactly is the flu?
So the flu is just a constitution of symptoms. It starts with normally acute onset, so sudden onset of fever, cough, body aches. Sometimes people also have congestion, diarrhea, so it could really be anything, but normally the key factor is that it just starts all of a sudden and you get the high fevers and the body aches with other symptoms mixed in.
How do you determine if somebody actually has the flu?
So normally it's a clinical diagnosis, so you come in the office, you tell us your symptoms, but also we can test for the flu with a rapid test that takes about 15 minutes in the office.
Wow, so if somebody is determined to have the flu, what treatment do you usually advise?
We normally, if it's been within 2 to 3 days, we can give you an antiviral called Tamiflu. It's 1 tab twice a day for a total of 5 days. Otherwise, if it's past that time period, it's not very effective. So then we just say, go home, take care of yourself, rest, you know, TLC.
Stay away from other people.
Yeah.
Tamiflu, how exactly does that work against the virus that causes influenza?
Good question. So it works against type A and type B flu, so that's why we like to use it. Pretty much it attacks at the virus and breaks it down so it doesn't continue to replicate and cause symptoms.
So if somebody gets on that immediately after symptoms set on, how quickly usually do things wrap up for them?
Everyone's a little bit different. Flu can last anywhere between 7 and 10 days. Depending on when you start it, they say it shortens the duration of your symptoms by about a day, and it can make the symptoms less severe. But you should also obviously be taking Tylenol and ibuprofen to kind of help you out a little bit.
So there are over-the-counter kind of make you feel better things
symptom
to take.
management medicines.
When the flu sets in, we hear quite frequently of people needing to go to the hospital. How does one know when your flu is severe enough that you do need to seek advanced medical care?
Good question. So normally the flu, the complications of flu often affect the really young or the really old or people with other chronic medical conditions. So if you have heart disease, lung disease, we always advise getting the flu shot because it can easily exacerbate your already symptoms of, congestive heart failure, asthma, you name it.
So if I had the flu, when do I know that I need to go seek emergency treatment? Would it be difficult breathing? Would it be a fever too high? When would you advise your patients to get directly to an emergency room?
I would say if you have shortness of breath, if you get chest pains, if your fever's not coming down with the regular Tylenol and Motrin, if the cough is so severe that, you're coughing up blood. Things that you think, and it depends kind of what hours you are getting the symptoms too.
So it would be the alarming symptoms.
Yes.
And you mentioned the flu shot. So as far as preventing the flu, would you say the flu shots are first defense?
I would say flu shots are first defense. We do recommend that everyone gets the flu shot because every year, the flu, viruses are very smart, so they're always evolving. And so they try to come up with vaccinations that cover those viruses every year. And you can, shorten the duration of your flu because you've already built in antibodies once you get the flu shot. And we've seen, we see so many people hospitalized every year just from a simple flu that turns into something else. So if you can prevent that, we definitely recommend it.
A lot of people, there's the flu shot myth. A lot of people say, oh, I can't get the flu shot because I will get the flu from the flu shot.
Yeah.
What's your opinion on that?
So anytime you get, there's two types of flu shots. There's the inactivated vaccine and then there's the live vaccine. Anytime we put a foreign body into our system, our body naturally builds up immunity or antibodies towards that. So it's gonna, while your body's fighting off something, just like when it's fighting a cold, you're more susceptible to other viruses and common colds and, different things that are out there. So sometimes when people say, oh, I got the flu from the flu shot, it's probably more, your immunity's waning a little bit, you probably caught some other cold, and you just symptomatically treat that, and but it's not caused by the actual flu vaccine that we give them, because that's a dead vaccine.
And how long does the flu shot take to become effective?
The flu shot takes about 2 weeks to become effective, but just know if you have symptoms of the flu, normally it starts about a day before you start having symptoms and then 5 days after the symptoms onset. So you can shed the virus for about 6 days.
So other means of preventing the flu, what do you suggest?
So, proper hand hygiene, washing your hands, keeping toothbrushes separate, using your own towels, wiping down faucet heads and doorknobs and keyboards, especially now in the day, everyone's using, the cell phones, the iPads, the computers. And yeah, if someone's, if you're sick with the flu, please stay home. Sometimes we can treat you over the phone at the doctor's office instead of infecting everyone in our waiting room. And just know, I think a lot of people think, well, I'm healthy, I don't need the flu shot, but especially during the holiday season, a lot of us have, little nieces and nephews, grandkids, or grandparents that we see, and, if we don't get the flu shot and we get the flu and we expose them, I think a lot of people don't think about that aspect.
And the flu season usually runs when to when?
Anywhere between early December to early March.
So we're still in the middle of it.
Yep.
How has it been this year at your office? Are you seeing a lot?
So we saw a huge wave right before Christmas, so that was unfortunate for some people. And then actually I've probably seen about 5 or 6 cases this week alone.
So it's spiking again. And do you usually see at your office, when do your patients and how often they're coming in with the flu reflect what's going on in the state or nationally as far as spikes?
I think Illinois always starts a little bit earlier. I was just looking at the CDC website. We started just about when our office saw it. So it's pretty, I think, consistent with what we're seeing across the state this year. And
how would you categorize this year's flu? Would you say it's one of the nasty strains, or are people recovering pretty easily from it?
This year, my husband had the flu this year early on. So
did he have a flu shot?
No, he didn't. And I had the flu shot and I didn't have the flu. So, but it's been lasting about 7 to 10 days. I think the worst part is after the fever and the body aches, people have been having a very harsh cough that lasts weeks afterwards. So that's been the tough part to get over.
And as far as contagion, if you do start to get flu symptoms, when does the contagion last? How long should you kind of put yourself in solitary quarantine away from other people just as a matter of good health?
So like I said before, if you're gonna if it's been a couple days, you're not sure if it's the flu, because the flu can mimic so many other upper respiratory infections. You can start shedding the virus 1 day before the flu symptoms start, and then for 5 days afterwards. So you should probably just lay low anyways, just for yourself to rest and kind of recuperate. If you start the Tamiflu, the antiviral medication, normally we say after 24 to 36 hours you can go back to school, go back to work if you feel up for it.
Terrific. And Dr. Diaz, tell us a little bit about your practice here in Schaumburg.
So we're a large family practice specialty. We've been around for about 30 years. We have 5 doctors and 2 physician's assistants, so pretty robust practice. We see everyone from the day you're born until elderly. and anything in between. So.
And yourself, your personal practice, your family practice, your
Yep,
cradle to grave, as
Yep.
they say. And Dr. Diaz is located right at 25 East Schaumburg Road. And Dr. Diaz, thank you. Is there anything you'd like to add about the flu?
No, yeah, if you still have a chance, get your flu shot this year.
It's not too late.
It's not too late.
And they are available pretty much everywhere.
Yep, at our office, at Walgreens, anywhere.
So stay healthy this season, and thank you, Dr. Diaz, for joining us
You're
today.
welcome.
And we'll be back after these messages.